Dear medicos, we are having the honor to have Dr. Angie Garg with us, Punjab rank 22, doing MD Radiodiagnosis DMC Ludhiana. So, beta, first of all, we congrats you on the behalf of DAMS family after getting your dream branch. How you're feeling now, beta?
Thank you so much, sir. This is a very proud moment for me to be here and share my view with everyone. So this was an amazing experience to be a part of a dance family where we are constantly motivated and where we have been taught all the necessary concepts and the technique to solve the exams, which is very important to learn during your journey. Just not going through the theory, but learning the technique to solve the questions, which is very well taught in all the classes by all the faculty members, is a very important factor which helps you score a good rank and good marks in your exam.
That's great, beta. So, first of all, before starting, we want to use this platform to motivate all the juniors. So, first of all, we congrats your parents for such a nice success. You are joining Dream Branch because without their sacrifice, this would not be possible. Any words from your side, beta?
So definitely parents and all a dance family also acts as parents only when you are there with them for 3 years or 4 years, where they teach you all the necessary things which are needed for the exam, right from the motivation, from the knowledge to all the till the question bank and the test series. All that a very complete package is given, and at the end, when you are done with all the subjects and you have revised 2 3 times, then the DBT session which is provided. That is very much helpful for everyone, and the back support of your parents at every time will make you go through this journey very easily. This is not an
So,
impossible journey, a
yeah,
very
yeah.
journey that can be achieved with full determination.
That's great, beta. That's great. You concise everything, the things which were very crucial for getting such awesome achievement. So, beta, now
Yes.
I just want to go one by one. Like you started with classroom learning. So, how was the experience of classroom learning, beta, at DAMS Amritsar? Like you were, so you attended all the live lectures there in the classroom as a foundation. So, how was the experience? How you used to attend? How you manage college classes, college routine with the weekend classes, beta?
Sir, at weekends we didn't have a very busy schedule at the college, so it was easy for us to attend the classes. So the classes when we used to read from 8 a.m. to 8 p.m. First we were like, oh, such a long class. But once we enter the classroom and we start making the notes after listening to the teacher, it doesn't feel like it's such a long class, and you can attend for 2 3 days as long many days you want to attend. It's so interesting, and you understand the things which you certainly miss in your college during your college exams for your theory preparation. Certain things which are covered very beautifully in your virtual classes that makes your learning, that enhances your learning in a very good way, which is very much needed for your theoretical purpose as well as competitive purpose and also in your practical life. It is a combined package that helps you throughout in all. I have been a dance foundation student, so I have been attending the classes for 3 years and giving the TNDs. So it was a very amazing experience. I think without dance, my theoretical knowledge would have not been enhanced.
So we are sitting for 4 to 5 hours. Many students they take a shortcut of recorded lectures, give I to go for the classroom. So what do you feel after joining? Like you are doing like MD radio diagnosis after getting your dream branch. What do you feel the hard efforts which you have done in a third year, fourth year internship, those were worth it?
Yes, sir. Sir, like sitting for 12 hours long gives you a motivation to come back and study. So if you don't develop a habit of sitting for long hours, which you very easily develop while you are attending the classes. So that keeps on motivating you, like you have spent already so much time in attending the classes and making the notes. So after coming back, you get a feeling that no, you should study. And then with time you get the habit of sitting and revising your notes. The notes that are made in the one go by attending the 12 hours long classes, there's no match for the video session for that. That is the best part that I used to like, that we can make all the notes in front of the teacher as a live class. If we have any doubt, we can approach any faculty during our breaks anytime, or even on online also, or on WhatsApp, Facebook, and all our queries were answered. So teacher standing in front of us motivates us more. That gives us more. strength that no, we have to study, because all the motivation during the classes that was very necessary to maintain the spirit throughout.
That's great, beta. That's great. Now, coming on the conceptual part, like you attended all these sessions live at Amritsar. So, how was the experience? What is the value of conceptual learning in your awesome rank of Punjab 22, beta?
So concepts are very important to crack any question. If you are clear with the concept, you can easily like rule out the other choices, why the other choice is wrong. If you are not clear with the concept, just rectification, you get confused between two choices. So when you are clear with the concept and when you go with the thorough revision of the topic, so revision becomes very easy if you know the concept. Just rectification of this topic, you will just forget it within 2 or 3 days and you will feel like you don't know anything. So the concepts were very beautifully and in a very good way covered in the class. Teacher like makes all the best effort with the slides, with the like manual and physical appearance, like everything was covered in such a beautiful way, especially the ortho session, the ENT session, the way they use their hands and all the things to explain, and their words during the session actually made the concept very clear, like you are actually visualizing the patient in front of you. So when
That's
you go
great.
home, you read the question, you actually visualize ki, yes, this was the question, this was the patient you examined in the classroom, and yes, this is the answer for the choice. So that way it helps in a very good way.
Yeah. So, beta, like after getting all these live lectures, you must have attended, like before going for the NEET examination, you must have attended your our AIIMS PG capsule, all the GT recording, GT videos. How was the experience on e-medicals, beta? All the capsules or videos updated.
So, like DAM's AIMS PG capsule is the most important part for any exam, whether it is AIMS, NEET, or NEET also, PGI or NEET. So, all the this such a summary is given in such a good way that you need not open the notes again. The subject is covered in such a easy way that just 2 or 3 days, if you go through the AIMS PG capsule, like you are like yes, you know like you get to know with the topics, you freshen your knowledge, freshens up again, and just one day before don't see anything. And you I actually saw many questions which were asked from the AIMS capsule, and I could easily attempt because yes, I have heard those things in the PG capsule, and those helped me score a better rank.
Like in the last NEET, the paper was on the tougher side. It was because
Yes,
everybody was saying after NEET 2020, that this paper is on the platform of AIIMS, beta.
yes,
Yeah.
yes, yes, sir,
So
yes, sir.
these capsules played the important role in getting such awesome rank, beta.
A very important role, sir, even in the AIMS exam as well as in NEET, because you get the clinical orientation with the topic. So, like, if you're thorough with the topic, whether it is a clinical question or a factual question, it is easy for you to attempt. It doesn't matter whether, like, the paper is clinically oriented, like, it does matter. But once you're thorough with the topic, you have revised it, you can easily crack the factual question as well as the clinical question, because it becomes the application of your knowledge, which is very well covered in these videos. So all the recent updates in pharmacology, in gynecology, all were very much covered. All the drugs were covered. So many questions were asked in PGI also, which so the remembering the drugs became easier by hearing the videos.
That's great, beta. Like on this e-medicals platform, you must have appeared for grand test class after giving your class test. You must have appeared for grand test and SWT and question. What was the experience of that bank in your NEET preparation, beta?
That actually helped me, like after attending a class, giving a class test. That helps you how much you have gone through the class attentively. Then you read the notes in that way that yes, you have missed out these topics in the classroom and you need to go through these. Then once you start revising your 19 subjects, you prepare a revision strategy. It's better like if we do certain questions from the question bank from the DQBs, and after studying the subject, then we can give the test. All the weak points, which then they become highlighted in the videos which are discussed for the subject wise test. This video discussion of the subject wise test was very important to actually highlight the points which I was making repeatedly mistakes were made on the topics. So that actually helped me improve my rank and helped me to focus on the topics which were actually weak, because when a faculty speaks, you get a different impression of the same thing. So like faculty knows where students can lag, so they highlight only those important things, and they teach you in the video all the options which should be ruled out, in what manner, and hence they arrive to the answer. So that was a very good part of this. And sir, attending the grand test, so Maysir said in the class that we should start giving the grand test from March, April, or whenever we plan to start our like preparation for the exams, because that helps you know how much you have gone through, like actually gone through well during your MBBS time, and how much you need to focus more during this year. And then with repeatedly giving more and more tests, you get to know your weak points and all the things, all the subjects which you should focus on more, like the which subject has more percentage of questions, which subject has less percentage of questions. You can cover more in good this subject, you can cover more in this subject. So grant is giving every monthly and then later reducing the interval actually helped me, because that also helps you to attempt the question in 3 hours. Because many people they complained after the exam that they could not complete the exam, but I did
Time
not face problem because I had practiced many grand tests. So I could complete my exam first and even give a second reading so that I could see which questions I have missed out and which I can mark for the better options. That
management.
actually practice helps you a lot.
Definitely. So, because during these grand tests, you appeared for all the grand tests like sincerely. So, somewhere you may uh, didn't get the marks up to your expectation. That a low phase of your preparation. So, how you used to handle that? Because many students feel K toppers they always have a continuous top performance. So, was it
Yeah.
that can you share the low experience how you handle the low phase of your preparation?
So actually, I didn't focus much on like I'm getting low. I focused on my mistakes more. Like I was always determined. I actually always saw radio diagnosis in my mind that no, I have to achieve this no matter what. So I was comparing myself with others, I'll just lose the motivation. So the best
You get
strategy I thought to go through was to look at the mistakes more than where I stand. And going through my mistakes actually helped me improve my score. Like from 500, I gradually started scoring 750, 800, 850. Like eventually the score improved. So that
got
was,
it.
if I started comparing the day I used to compare myself with others, I used to be demoralized. Like at times I felt that I cannot do it. But then always the dream comes in your mind, no, you have to do it, you cannot live in between. So you always go through your mistakes and improve on that. So that is
It
the
is
most important.
these phases are inevitable. Is there with everybody? Yeah. What
Yes,
message?
yes.
Because the all medicals across the country are listening to your words, so they will they will get a nice motivation. Okay, yeah, it is with everybody. Okay, you are getting low marks, but you should take it as a motivation. But
So because it also depends upon the grant test. Certain grant tests you feel are easy. Certain grant tests you feel like just to keep the child on track, the candidate on the track, they give you higher level of questions so that nobody is overconfident. Like yes, I know everything. That is also very important. If we continuously score a good rank at certain point of time during the end days, people tend to lose the tendency to sit for long hours and study, which is needed the most at those times. So I believe that the rise and fall is necessary so that you know that actually you can go down and you need to work hard. You cannot give up at any time. If you have a up phase once, you can definitely maintain it. But if you're going down, there's no need to be demoralized. That is very like common with everyone. All the like top rankers, they get this phase, and that is very natural for a human brain. So the human brain can train itself anytime. So just training your mind in the right way, knowing the right path by going through the faculty videos every time, frequently, whenever you are low, that helps you to follow the right path and not waste time. So no, it like time is very precious. Like whatever you study, like if you're studying for 2 hours, that should be very effective. It should not be like you are just reading the notes blindly. So your effectiveness, your output measures matters, but not how much you are just like how many hours you are studying. So that is the point.
So, but like you are giving nice, honest feedback for all your juniors. So now coming back on the subject-wise distribution, like in getting a dream branch, what do you feel out of these 19 subjects, which subject should be given more importance, or these are the basic subjects? Yeah, I should be confident of these subjects. What do you feel out of 19 subjects?
So actually, I started with the basic subjects first. Like I went through the first prof first, like because like from 4 years you tend to forget those topics a little bit. So it's always better to start from the basics, from anatomy, physiology, and biochemistry, and then you go to like the second year. Second year is very important, as it sets a very important basic platform to attempt all the questions, whether clinical or factual. Like pathology, pharmacology covers a major part of the questions, along with microbiology, which is very much covered in AIIMS. AIIMS asks many questions from microbiology also. Then, sir, I jumped directly to the final year subjects because I thought that I should go in this sequence from first year, second year, then to the final year. And along with final year, I covered the SPM. And
Okay.
then I later on I focus more on the short subjects. So I just try to maintain the balance that I should cover all the subjects with complete basic knowledge and the advanced knowledge which is possible for me. So that I believe that everyone should focus more on the basic subjects, so the clinical subjects automatically becomes easier for you because you are left major with the diagnostic and the treatment part. If you know the basics, so the all the etiology, you need not ratify the etiology. You'll understand why this is the cause for this disease if you know the basic pathology behind it. So your etiology part, rectification of the etiology part lessens a lot. So going through the basic part, focusing on the major subjects, which like gynecology, surgery, medicine, SPM, and then covering the short subjects, because at certain times what happens is short subjects helps you score a good rank at times. Like you are not able to attempt surgery all the questions, but at times you are able to attempt a short subject with good efficacy. So none of the subjects should be neglected because all the subjects are correlated. If you study one thing in one subject and the other thing in the other subject, so so you remember that yes, this topic was covered there also. It was covered in this way. So that helps you enhance your efficacy to attempt
What
the
I'm
questions.
what I'm getting from your words, you are talking about integrated way of learning. You should go jump from first year, second year directly to medicine surgery. So
Yes,
like
sir.
all
Yes.
juniors across the country, they are going for next examination after 2 years. So what will be your strategy? Yeah, if I want to go for next examination in which they have integrated way of learning clinical MCQs. So what I'm getting from your words, we should focus on the first year, second year, and we should integrate it to the clinical medicine side.
Yes. Sir,
That is
if you
what
are
I'm.
clear with basic subjects, you need not ratify anything. Like a topic comes in front of you, half of the things are clear in your mind. So this is the way you also taught in the classes. You first gave all the things which were needed before the topic, and once we used to reach to the topic, more than half of the things we already knew about the topic.
Then
So
you
being
apply.
clear about
Yeah. Yeah, beta. Continue.
so
Yeah.
yeah, being clear about the basics, they won't like you won't fear the clinical questions. You will be like, yes, you know this basic, like for example, anatomy and surgery. Like if you know the location of the muscle very well, so you can easily tell the diagnostic test for the muscle, in which way you
Yeah.
have to move, what is the action of the muscle, which nerve is supplied. So even in orthopedics, in medicine, all these examples help you in a very good way that you need not memorize anything. By just looking at the image in front of you, you can correlate ki, yes, you studied this in an anatomy and this is the application for this topic. So that way it helps you. The integrated approach to the subjects is very important. Otherwise, it will feel as a burden, like it is too much to study. So
So now
that is why I.
absolutely, you're giving very nice strategy. You should concentrate on the integrated way of learning. So, beta, after all attending lectures, rank tests, you must have attended our DVT session. How was the experience of DVT, beta?
So DVT, I believe, is the most important part to one should attend because I attended this DVT session very sincerely. Teachers brushed up the revision in such a good way Like after coming back, like before your exam, if you're just going through the DVT videos which were provided to us, that made us feel like yes, we have revised 19 subjects in a very short time. All the important points were covered like in the clinical questions along with their answers, and everything was covered. Like all the subjects, I felt ki, oh wow, I can revise in such a short time. Such a brief and a precise revision it was. Like nobody should miss it. Like I actually recommend everyone for the DVT session because all the updates are covered, all the important points are highlighted, and one should focus on the revision of the parts which are covered in the DVT session.
That's great, beta. Now, coming at the last beta, what was the role of DAMS family? Like motivation you were getting from the DAMS family. What was the role of in your preparation, in your success journey, beta?
So Dam's family, the way Dam's family motivates, I think I haven't got any motivation like that. The frequent videos we got on the e-medicos and on like in the live classes that actually helped us build like ki, yes, there is something which we need to do and we can do it. Like there is nothing that it cannot be like ki if he's able to do it or she's able to do it, I cannot do it. Everybody can do it. It is just a matter of determination, which was always taught in our classes. Sitting for 12 hours long in the classes is not an easy task. A person who is determined to achieve to his branch, to achieve to his destination, only that person can sit for 12 hours long. So just completely studying for 12 hours is also not possible. The regular motivation after every 1 hour, 2 hour we used to get in the class made us like easier for us like to sit for long duration in the classes and stay connected with the dams family. Going through all the problems, all our queries were solved at every step. We never felt like yes, we are not answer to the queries. Whether Dams Facebook Club that has played a major role. All the updates those were updated there. All the PDF files those were updated. Special sections were made by for all the subjects. Whatever query you have, you can go to that particular subject, search for the topic, and you get all the answers which were answered by the faculty members. There was no question that and which I believe I posted in the group and was not answered for me. So all the queries were taken very seriously, and all the motivation to stay determined and to stay disciplined was very necessary, as it was always taught if you are keeping a 6 hours duration in the beginning to study, it should be maintained to 6 hours. It should be not like one day you are studying 6 hours and next day 10 hours and not doing anything for a week. If you feel like you are a person for 6 hours, start with 6 hours and gradually try to increase every 1 hour with time. Gradually, things will happen. Nothing is impossible. Even if in 6 hours a person gives a best output, like they're actually giving 6 hours to the studies, that actually becomes equal to the 8 hours. So you feel like you just need to add to 1 or 2 hours with time so that your strategy reaches to 8 hours and 10 hours. And eventually during your end period, the time little bit increases. And the most important motivation which I got from dance was about the revision. Like Sachin sir used to say, revision is revisiting your notes. So that is the most important part, which is very important for your any competitive exam. Where, like I believe AIIMS and PGI, I used to like hear in my college like AIIMS and PGI is not of our level, but I don't think that it is like
But
this.
now you are
People
reaching
get
a
this
new
out
branch.
of their, sorry
So,
sir.
beta, any specific message you want to give to any faculty of DAMS ke yeah, who played important role in success journey, beta?
So actually, I'm actually thankful to all the faculty members, like whether somebody through Facebook, from the Facebook pages or their virtual classes or like DBT sessions, though those dancing videos of the DBT sessions, those light sessions at the end, which we used to get, that was very relieving for us. So it was a very amazing. I actually like I can say all the faculty members were always in my mind, especially those short videos which are uploaded on eMedicos every Wednesday. That played a very important role in my preparation because whenever I was like I'm free for 5 minutes, I used to go through the video. So the important topic of that subject is covered. So all the faculty members had played a very important role in updating all those Wednesday topics. So that is very important. One should always go through, because actually 2 3 questions directly came in the AIIMS exam as well as in the NEET exam. Those questions were directly asked. So that is why. So all the faculty members have played a very very important role in my life. I cannot
And
say that this faculty played more role. Actually, all played the best role in my life.
we all
Very.
the whole DAMS family wish you very best of luck, Beta, for giving such a honest feedback to all your juniors. Now, at the last, Beta, like I will be giving you a opportunity to say any special message for SGRD juniors. You are from SGRD Amritsar, so any special message, any motivation message, ki, yeah, we people can do.
I would like to say to them that always try to think that you can do this in your internship. Never have the, like in my college, it was a view that yes, we have one more year, like we can prepare. That should never in your mind. You should always be like, no, internship is the only target. So everyone, I believe, should start preparing from second year or third year onwards. Like attending the classes from third year onwards gave me a platform where I was like prepared both for the theoretical exams as well as my competitive exams. Like this, I have to study for the theory, and this way I have to prepare myself for the competitive exam. So all the notes, they also help me to like prepare for my theoretical exams, my prof exams. So all the SGRD interns, I would say, ki definitely attend all the classes, make proper notes, and a very special test series have been planned for them every 14 days. I believe that is the most important part one can get, because giving tests is the most important part of your preparation. If you don't give a test, you don't know where you stand.
That is the most important step taken by your management. But I hats off to your management people who are taking awesome efforts for your juniors. Peter.
Yes, sir. I am proud of my college that they have given me such a good platform and like motivated me, helped me get the best knowledge from all the faculties that is possible. Yes, sir.
Thank you, Beta. Thank you for giving such a awesome interview on this platform. Thank you, Beta. Stop it. Thank you.
Thank you.